Hello, everyone. My name is Daniel Carrion. I am the Program Director for the Summer Public Health Scholars Program, located here at Columbia University Medical Center. We're situated in the Office of Diversity and Multicultural Affairs in the College of Physicians and Surgeons. So today we have a webinar for you, and I'm going to introduce our speaker. So we have Miss Heather Butts. She's the founder of Learn for Life Consulting. Additionally, she's an adjunct professor at the Columbia University School of Public Health and at St. John's University School of Law. Prior to this work, Ms. Butts served for over 7 years as a regulatory specialist at Columbia University Medical Center Institutional Review Board, IRB. She's been involved in updating CUMC's investigators and IRB members on regulatory changes, as well as training and education efforts of Columbia University research community. She's authored several publications in the area of health and ethics and regulations. Prior to her work at Columbia, Ms. Butts was a senior associate at PricewaterhouseCoopers in New York, where she performed compliance, risk assessments, outreach, and education. So Ms. Butts will be speaking today on the Affordable Care Act and the healthcare workforce. We're recording this webinar, so you'll be able to reference it in the future if you'd like. Please also note that you have web links towards the bottom right-hand corner of your screen, and these are additional resources that you can refer to in the future. Feel free to download them. If you have to leave the webinar early, that's completely fine. However, if you don't mind, please fill out a webinar evaluation survey before you go. And at the very end, we'll also remind you again about that. Please save your questions to the very end of the webinar. We'll have a Q&A at the end. And without further ado, we have Ms. Butts with us.
Hello, everybody. So thank you very much, Daniel, for your wonderful introduction to me. I think what we're going to do is I'm just going to spend a couple of minutes sort of giving you an introduction on the Affordable Care Act generally. Daniel was good enough to sort of direct me in terms of specifics for this presentation. Because I teach the Affordable Care Act, I tend to focus a lot on the legislative components of it, as well as the Supreme Court ramifications. I actually will talk about that for a minute or two, but I'm going to focus my remarks on workforce issues, and I have some materials which I'm happy to share with you after this presentation, in addition to the wonderful links that you have that deal with workforce training, and hopefully that will be of some assistance and help to you. And then we'll finish up by going over some of the slides that I have that have to do more with questions and sort of Q&A. And then if you have any questions, I believe, Daniel, can they type questions in the chat area if they have questions, or should they save them to the end?
They should save them to the end.
Okay, so just save your questions to the end, and then we'll get them at that point, all right? Okay, so first what I want to do is just do a little bit of going over the Affordable Care Act generally and the Supreme Court case. And what I'm going to do is I'm going to talk to you a little bit about the three components of it, which will lead us into talking about employment and the Affordable Care Act. And of 2010. And when it went into effect, actually, it pretty much ushered in changes for healthcare as we know it in this country immediately. One of the groups that was sort of most distressed prior to the Affordable Care Act were individuals who had pre-existing conditions. So the groups that the Affordable Care Act was most concerned about were the 45 million approximately individuals who do not have health insurance in this country. And that translates into roughly about 15% of individuals, approximately 85% of individuals in this country have health care insurance, either and this probably applies to a number of you, they're on their parents' plan, or they have it through their employers, or they just have it because they've somehow purchased into it. But 15% approximately of individuals in this country, up until the Affordable Care Act was passed, did not have any form of insurance. So that's mainly who was being targeted. A second group that was being targeted, which essentially is the rest of us, is ensuring that individuals who do have health care that's appropriate, so that we all have healthcare that's appropriate, and that meets the minimum necessary standards that healthcare should meet. And we'll talk about that a little bit in terms of what those minimum standards are. So the Affordable Care Act passed March 2010. Took about 2 years for it to get to the Supreme Court, which it then did. And the Supreme Court case actually finally was heard in June of 2012. So the Supreme Court case, actually, the Supreme Court case was heard a little bit earlier than that. It was heard in May of 2012. The decision came down in June 2012. And what were the important parts of it? So the main parts have to do with what the main parts of the Affordable Care Act are for purposes of whether or not it is legal or constitutional. Those areas have to do with the individual mandate, which probably a lot of you have heard about. I'll spend a minute just telling you what the individual mandate is. Medicaid expansion, which is supposed to usher in health care for a fair number of the 45 million that I just described. And then the minimum necessary coverage for everybody else. So that has to do with what kind of coverage do the rest of us have. So the individual mandate essentially states that if you do not have health care coverage either through an employer or some other means, by January 1st, 2014, you must have some sort of coverage. And actually, because of the ushering in of the Affordable Care Act, that date has moved back a little bit. So individuals have actually until next month to buy into what are called state exchanges in order to procure insurance if they don't have it under their employers. Now, what was the problem that the Supreme Court was grappling with under the Affordable Care Act? Well, the main issue was one of legality, whether or not the Affordable Care Act's individual mandate and the Medicaid expansion, which I'll talk about in a moment, were legal. Now, why might these things not have been legal? Well, there were two reasons. The individual mandate stated that if you didn't have insurance, you either had to purchase insurance, which we just talked about, or you would be fined a certain amount of money. And that amount of money was the greater of 1% of your income, or for the first year, so this year, 2014, $95, then the next year is $325, with the final year being $695 for individuals, and it's higher for families. Now that percentage goes up to, by the time you get to 2016, it's actually 2.6%. So it goes up incrementally as do the numbers go up. The issue with this was that it was a little bit unclear as to whether or not the federal government had the power to actually implement something like the Affordable Care Act. And you may have noticed that people talked a lot about Massachusetts, the state of Massachusetts, which has a program very similar to the Affordable Care Act. So lawmakers pointed to Massachusetts as an example of where a state could do something like the Affordable Care Act, but it wasn't really clear whether or not the federal government could. Well, the Supreme Court decided on that in 2012, and essentially they came out in a 5-4 decision that, in fact, the Affordable Care Act was constitutional, and it was constitutional along taxing provisions of the federal government. So if you have a basic working knowledge about constitutional law, you would know that the federal government has very discrete powers, enumerated powers of the federal government. And they're not that many. The federal government can tax us. The federal government can spend its own money that it's raised by taxing us. The federal government obviously can raise a militia so they can wage war. The federal government has some interstate commerce powers. there's not too many other things that the federal government can do. So one of the things that a lot of people were sort of scratching their heads about with the Affordable Care Act was, well, where under a tax for purposes of the federal government's ability to implement the individual mandate and the Affordable Care Act. The other part of the Affordable Care Act that you probably heard a lot about was Medicaid expansion. So Medicaid expansion means that for individuals who had a certain threshold, and it's 133% of the poverty line level, for those individuals actually under the Affordable Care Act, before it went to the Supreme Court, those individuals would be covered under the Affordable Care Act. So they would be covered same way as we just described. The issue with that was whether or not, again, the federal government had the power to expand Medicaid in the way that they were expanding it, which was essentially to say that not only would states be beholden to the federal government in terms of the amount of money the federal government would give to states in order to expand, but states would have some funds withheld from them if they didn't expand. And the Supreme Court actually, in the 7-2 version of that, the Supreme Court decision decided that actually was not constitutional. So Medicaid expansion was deemed to not be constitutional. And that has created an interesting scenario because approximately half of the states in the U.S. had decided to go forward with the Medicaid expansion, but approximately half have not. So what does that leave us with? So that leaves us with an interesting scenario. So remember the 45 million people that we just described before? How many of them will be covered? So of the 45 million that currently do not have insurance, either because they're not on their parents' plan or they're not already on Medicare or on Medicaid, or they don't already receive insurance from their employer, of those, right off the top, approximately anywhere from 15 to 18 million, depending on what number you use, are not covered because they are undocumented immigrants. So the undocumented are not subject to the Affordable Care Act and not provided for in the Affordable Care Act. So that's that group right off the top. Then, as we've mentioned, there's the individuals who will not be part of the Medicaid expansion because their state will not be participating. That's anywhere from, the numbers vary, but that's several million people. And then you're left with individuals who may just decide not to buy into the individual mandate by virtue of deciding not to do so. That's basically the rest of the individuals. So it's a little bit unclear at this point how many people will be covered under the Affordable Care Act. And we basically just have to sort of wait and see what the numbers hold out. But that brings me to the next step part, which has to do with the state exchanges. So for any of you who are not on your parents' coverage, and I normally if I were in class I would say please raise your hands, but that's not really my business, so I wouldn't do that. But if I could do that in a way that was compliant with HIPAA, and get people's information about that, I would be very intrigued to know, just generally how many people would still be on their parents' insurance. So that's an interesting question. It's an interesting query. But if you are not on your parents' insurance, and you don't have coverage through other means through your school, one way that you would be looking, obviously, to get coverage, because coverage is very important, would be looking to the exchanges. And so you probably heard a lot of information regarding some of the difficulties that individuals have had in terms of applying for healthcare coverage either through the federal exchanges, which a number of states are part of, or some of the state exchanges. New York, for example, has its own New York State Exchange, and so that is separate from the federal exchange. So there's been some hitches and some glitches in terms of people's ability to actually get onto the Affordable Care Act exchanges. Oh, thank you, Daniel.
PowerPoint's right there.
Why, thank you. Oh, look at that. Isn't that wonderful? Thank you so much, Daniel, for helping me. Daniel's been exceedingly helpful, by the way. So he's like behind the scenes with his helpfulness. Okay, so as you can imagine, oh, and I'm glad Daniel just mentioned this to me because this is an interesting slide. There was a group of students that I work with. They're actually high school students, and they were doing a question about should the government be involved in making healthcare decisions for people. I like that you can see they did a lot of work in terms of answering this question. Um, but I think it's important because as we think about this issue, the Affordable Care Act, and you're all public health individuals or going to be in the public health arena, it's always important to sort of ask yourself this question: should the government be responsible for making sure people lead healthy lives? Is this under the purview of the government? And this is sort of an open-ended question. Some people would say, you know what, it's not really the government's purview. People should make sure that they're healthy, then these slides that are coming up, these 10 things you should know about the Patient Protection and Affordable Care Act, I will do them at the end after we talk about the workforce issues, and then I will leave some time for questions. But I wanted to spend a minute or two talking about these exchanges. So if you do not have health insurance, one way you will get insurance would be through these exchanges. And it's important to note that looking at the care that's in the exchanges, you would look at this care through a number of different lenses. So one would be the deductibles, and you probably heard about there's bronze plans and platinum plans and gold plans, and sounds like the Olympics, right? All sorts of the rainbow of plans, right? When you're looking at these plans, be sure to look at what the deductibles are, what the copays are, and then what the premiums are. It's very important because you want to make sure that you get the plan that is best suited for you. And the way to do that is to essentially have a working knowledge of what your healthcare needs are. Now, it's difficult if you're a younger person. It's probably a little bit more difficult to be able to assess that. But if you're somebody who maybe you have some sort of a chronic condition, diabetes or asthma or something like that, and you know that you're going to be lower, co-payments and lower premiums might be better. Or, well, they would have higher premiums, but would have lower deductibles, for example, might be better for you than some of the lower end plans that have lower premiums, but the deductibles might be a little bit higher and may not meet your needs. So just make sure that you're doing that when you look at when you're looking at the plans. So what I'm going to do now is I'm going to go through the minimum standards for these plans. And then I'm going to go through some of these workforce provisions because I think you're going to find those very interesting. I don't know how many of you know a lot about some of these workforce provisions, but some of them could have a great deal of meaning for you, especially if you're interested in saving some money, if you're already in the public health arena. So I'll go through them. There's about 19 of them that I want to make sure that I go through. I'll go through them pretty quickly, don't worry. And then I will take some questions. So these minimum standards. So by 2017, all businesses up to 100 employees will have to embrace these 10 minimum standards. Now remember, in order for an insurance plan to comply with the Affordable Care Act, so now we're not dealing anymore in the realm of the individual mandate and the constitutionality of that or the Medicaid provisions. Now we're dealing in terms of insurance packages. There's two things that they have to be sure they have. One is a strong benefit package, and this is where these 10 general categories are going to come in. And the second is limit cost sharing. So remember I was talking before about the deductibles and the premiums and so forth. Plans must pay 60% of health care costs. Now, this you might say to yourself, well, that still seems sort of like that's a lot, for an individual to pay. But if you think about what people have if you like it, you can keep it. If you like your plan, you can keep it. Part of the issue with that was that some people in the past have had plans that aren't that wonderful. They have extremely high deductibles, or their coverage is very, very poor. And even though these are plans that and for plans that didn't meet these minimum standards and weren't grandfathered into the Affordable Care Act, that's how individuals ended up losing their plans. All right, so these 10 categories. And so when you're going through your own plans, you should make sure that your plans, your coverage has these things, because if it doesn't, and you're covered, let's say under your parents' plan, or you have a plan that you were grandfathered into, it may not have an immediate impact for you, but over time, eventually, you're going to see even the large employers moving towards these minimum necessary categories, because if they don't, there's tax credits that individuals will be entitled to because the plans don't meet these minimum criteria. So these criteria are: one, the plan, in order to be a strong benefit plan, has to have ambulatory care provided. Two, there has to be hospitalization care. Three, this is a big one: mental health and substance abuse. This is huge for a lot of people. Very, very important. Three, rehab services. Four, preventive services and chronic disease management. This is a big one for individuals who have already have pre-existing conditions. Very important. Emergency care has to have emergency care built in. Maternity care, and this is a big one for people in the workforce. The Affordable Care Act does a lot to help people who are there's a lot to help people with respect to maternal care. It's wonderful. Prescription drugs. So obviously, again, very important, especially important for people who have pre-existing conditions. And lab services. Lab services, again, obviously, either, whether or not you have some sort of pre-existing condition, lab services, even for somebody who's just getting sort of the basic level of care on a regular basis, would be very important. And here's an interesting one that a lot of people don't know about: children's dental and vision. So, for those under the age of 18, children's dental and vision are covered under the Affordable Care Act. So that's a huge one. Okay, so now what I'm going to do is I'm going to talk for a couple of minutes about these workforce issues. Okay, and these have to do with, in addition to workforce issues, it just have to do with being in the workforce and how the Affordable Care Act can be of assistance to you, which I'll spend a moment talking about that. I'm also going to talk about these issues that have to do with how the Affordable Care Act can be of assistance to you if you are in the workforce, particularly from a monetary standpoint, which I'm sure we're all very interested in. I want to take a moment and talk about wellness programs, which we don't talk about a lot, but the Affordable Care Act actually has some pretty robust provisions for these wellness programs. And at the end, I can also talk to you a little bit about the sections where all of this resides in the Affordable Care Act. As I'm sure you can gather, the Affordable Care Act is fairly voluminous. So it's good to know where in the Affordable Care Act some of these sections are. But wellness programs are huge in the Affordable Care Act. So definitely keep that in mind as you're thinking about some of this, because wellness programs, for those of you who may not be completely clear about what they are, wellness programs are programs whereby an employer will assist employees in everything from walking programs to exercise programs to nutrition programs. Over the last few years, they've gotten a little bit more scrutiny because wellness programs have to be in compliant with all sorts of regulations, including Americans with Disabilities Act and so forth. So they've come under a little bit of scrutiny as of late, but wellness programs have made a big comeback in the Affordable Care Act. So for purposes of being in the workplace, it's something to definitely keep in mind and to note. All right, so the way this is split up with respect to workforce provisions, they're split up into 5 categories. The first has to do with public health workforce training. The second with clinical healthcare provider training. The third is public health infrastructure. Fourth is new public health programming. And the fifth is healthcare workforce analysis. Okay, so for your purposes, I think the first one's probably going to be the most important, so I'll spend the most time on that. So, public health workforce training. What does that mean? Okay, so there are several provisions under the Affordable Care Act that have to do with public health workforce training. I'll give you the sections, just because why not? And I'll generally tell you what they're about. If you want more information about either of them, we can talk about that, in the Q&A section, or we can talk offline. So first, Public Health Loan Repayment Program. This is Section 5204 of the Affordable Care Act. And this provision actually deals with creating a new program that provides up to $35,000 in loan repayment for public health professionals who work for a minimum of 3 years at a federal, state, local, or tribal public health agency. That's, I think, probably the most exciting one for your purposes. And again, that section, you can read more about that at Section 5204 of the Affordable Care Act. This is very easy for you to find, and you can also just get more information online, and I can send you additional information. Next is a mid-career training grant. This is Section 5206. Probably not going to be as pertinent for most of you in the short term, but in the long term, it very well may be. This creates a new program to support scholarships for mid-career public health and allied health professionals. And this is individuals who are working in public health agencies. And again, that's Section 5206. There's also a training grant. It's the Preventive Medicine and Public Health Training Grant. And this is for, again, preventive medicine residency programs. So may have some meaning for some of you, maybe not be as pertinent for others of you, but that is Section 10501. There's a fellowship. This is a very interesting one. Fellowship training in public health, and this actually expands. So there's already fellowships that are out there. This expands those fellowships, and it deals with training programs to meet. So as you can imagine, with the Affordable Care Act, whether or not 45 million new people come in, or whether or not it's 2 million. There will definitely be an increase in the need for public health workers. So obviously you're in the public health arena at just the right time. But with that, there's going to need to be incentives for getting people into the public health arena. So the programs that I'm describing right now are to incentivize you who are already in the public health arena or are about to go in, and also to attract individuals to public health in a training capacity. So that's what a lot of these programs are geared towards. Next is the U.S. Public Health Science Track. That's Section 5315, and it creates a new public health science track at selected schools of medicine, dentistry, nursing, public health, behavioral mental health, and physician assistants and pharmacy. So again, now we're going to move on to clinical care provider training. So again, this is going to have a little bit more meaning for those of you who are looking towards, the clinical care arena. And it may give you some insight in terms of thinking along those lines and going into that path. So we have the National Health Service Corps. That's sections 5207 and 5508. The Title VII Health Professions, Section 5301. Pretty self-explanatory, but these all just extend training programs for individuals who are interested in nursing and medicine and dentistry, and obviously overall public health. Okay. Next, we have the public health infrastructure. So this has to do with all sorts of establishing a reserve corps, grants to promote community health and school-based health centers. So that's actually, again, in thinking about some of this, somewhere you have to sort of think, in your own mind is what kind of opportunities is this creating long term for areas that I'm interested in. So, for example, there's grants for the construction and operation of school-based health centers. I personally know, being here in New York, this is huge, and we have several programs in the New York City area that are very dedicated to school-based health. So the fact that the federal government is putting even more efforts into this, it just will serve to have the need for more people going into this. It's Section 4101, and it creates new programs to fund construction and operations of school-based health centers. So again, if you can extrapolate from that, well, you know what? More school-based health centers, that means there's going to be more opportunities and more jobs. The meaning becomes very obvious in terms of possibilities for all of you in terms of work long term. Grants to promote community health workforce. Section 5313. This creates a new program for the CDC to award grants to states, local health departments, health clinics, hospitals, and so forth to use for community health programs. And community health programs would be an area to consider because there's going to be a lot of federal aid going into these programs in the intervening years. And then there's just other programming around this public health infrastructure that has to do with the actual, sort of brick and mortar building some of these places. Okay, the second to last is new public health programming. This is what I was talking about in terms of a lot of these maternal childhood health programs. There's a lot of focus under the ACA on maternal health and childhood health that you need to be aware of. So, maternal, infant, and early child home visiting program, yes, it does exist. Section 2951. And this creates a new grant program to support states and certain other agencies in funding early childhood visits. So this is home visits focused on reducing infant and maternal mortality, other prenatal complications. This program it's amazing. So that is section 2951, and that's a maternal, infant, and early childhood home visiting program. And once again, I feel like I'm a broken record, but if you're thinking along the lines of, what areas should I be looking into, this would be a pretty obvious one to think about long term in terms of um, jobs and workforce long term. And then community transformation grants, this is section 4201. And this creates a new program which essentially is a ARRA, American Recovery and Reinvestment Act, providing support for evidence-based, community-based activities to promote health and prevention of chronic diseases, smoking cessation, prevention program. The Affordable Care Act, again, I think a lot of focus has been devoted to the constitutionality of the Affordable Care Act, with a lot less devoted to a lot of the programs that are geared towards prevention. But as you can see from what I've been talking most of what I've been talking about over the last 10 minutes has to do with these programs that are geared towards prevention. And that really, if we think about how to curb healthcare costs over the next couple of decades, prevention is going to be the way to do that. And so these programs are laser focused on prevention and preventing some of these chronic diseases that afflict communities on a daily basis. And so this is an example of that. The last one is healthcare workforce analysis. So we can't have expanding workforce without analyzing it, right? So we got the National Healthcare Workforce Commission, the National Center for Workforce Analysis, and the State Healthcare Workforce Grants. And these are all geared towards essentially evaluation of these programs. Are they working? What are they doing? And again, there's funding for all of these. So there's grant funding available, and it's going to be substantial in terms of the focus. So that's all 19 of them. And again, I'm happy to provide you more information on any of them that you're interested in. I would highly recommend focusing on the grant programs and then these expansion of prevention programs, because as time goes on, there's going to be more and more of a need for individuals to go into these areas specifically, and it will just create more of opportunities for you, especially if you're not really sure what areas of public health you want to go into. These are the areas where they're going to be looking for people in the very, very near future, and for some of them, like the school-based programs, are already looking. So definitely keep that in mind going forward. All right, so the last thing I'm going to do before I take questions is I just want to, I'm happy to provide you with this PowerPoint. I'm just going to go through it kind of quickly just so you can get a sense about it. It's just sort of 10 things that I put down as things I think you should know about the ACA, and they're not in any particular order. They're just sort of things that I think are important for you to know. And, as I mentioned, the ACA went into effect almost 4 years ago to the date. Some of the things you should be aware of: Medicaid drug rebate for brand name drugs. And we talked a little bit about, remember, think about some of these things as sort of Outcomes Research Institute. Again, the ACA has a lot of QA evaluation programs, basically to make sure that it's working. And this is an example of them. This is just one example. For number two, I would say too, have access to a wide array of healthcare choices. This is huge. I mean, this is a game changer. This means that individuals who previously had healthcare conditions that bar them from buying into the Affordable Care Act, or buying into insurance, now have the ability under the Affordable Care Act to buy in. And this happened early. So the Obama administration early on said, we're going to create these high risk pools for individuals who have these pre-existing conditions, and we're going to get them in early, very, very early. This was created, the Affordable Care Act passed in March. By June of 2010, these high-risk pools were already in effect. So the administration stuck to its commitment to make sure that individuals who were high risk were covered very, very early on. Children will be able to remain on their parents' insurance until age 26. And if you live in New York, that's actually till age 29. So that's just something to keep in mind. But up through your 26th birthday, you can stay on your parents' plan. Now, again, you still want to know, the ins and outs of the Affordable Care Act provisions, because once you roll off, obviously you're going to have to deal with making some decisions if you're not covered under your employer's insurance. And you still, even though you're going to be on your parents' insurance, you still want to know what that insurance looks like. So it's good to have a conversation, with your family to find out what's covered, what's not covered, and what that looks like. But it's a pretty good deal too, because it doesn't even matter. I mean, you can be married, you can not live with your parents. It's a pretty good deal, I have to say. So all of you, if you're able to, should be taking advantage of it. Insurers are prohibited from dropping policyholders when they get sick. And insurance takes you on, then they can't say, a little while later, oh, you know what, we're going to drop you because you've gotten sicker than we thought you would get. That can't happen. Temporary credit programs established to encourage private investment in new therapies for disease treatment and prevention. Again, this is just more of this, looking at ways to prevent disease before it gets out of hand for individuals, and looking for innovative ways to care for people. Expanded Medicaid eligibility. So this is what we talked about. Yes, it's going to expand, not for everybody, because the Supreme Court decision was that the expansion wasn't constitutional in the way it was structured. But about half the states will go forward with the expansion. And so many more people will automatically be able to enroll in Medicaid by virtue of this expansion, this 133% of the poverty line qualifier. Tax credits. So the tax credits, again, some of this stuff is sort of a work in progress in terms of how it's going to be rolling in. But the small businesses, some of those provisions have been pushed off till 2015 and maybe even a little bit later. But eventually, all of these tax credits will come into play for these small employers. Individual mandate penalty, right? So this is real time, January 1st, 2014. And as I mentioned, the provisions will be in place for individuals during tax season. So just be aware and be prepared. And I like this one. This is a really interesting one. Chain restaurants and food vendor caloric requirements. So if you've noticed, and if you live in New York, this has actually been around for a while. The Bloomberg administration tackled this very early on, but now this is part of the Affordable Care Act. For chain restaurants and food vendors with 20 or more locations, there is a requirement to display caloric content through food on menus, drive-through menus, vending machines. They must also have in place, information about nutrition at the restaurant. So if you go to a McDonald's and you'll see the calories, but you can also go to you can go to somebody and say, okay, I actually not only want to know what the caloric value of McNuggets are, and you probably don't want to know that, but you not only want to know what the calories are, but you could say, you know what, I also want to know the nutritional value of, an egg McMuffin, or I don't even know if they serve at McDonald's anymore. Do they serve egg McMuffins anymore? I think so. Egg McMuffins or filet of fish or whatever. So you can get that information as well as getting the calorie counter. But the Affordable Care Act requires that restaurants with 20 or more chains have that information. Yeah, a couple of bonus provisions. So I don't know if you guys noticed, but when the Affordable Care Act was sort of heating up, and there were some questions regarding, some of the issues, a lot of Congress members were getting questioned regarding why they weren't part of the Affordable Care Act. So right now, members of Congress aren't part of the exchanges. Um, and it's sort of caused like a little sort of interesting thing. You probably heard some congressional members have said, "No, I'm going in the exchange. I'm actually absolutely going to do that." Keep that, just sort of keep an eye on that. It's kind of an interesting one. And you know, also this ushering in of, again, prevention. That's really the takeaway from the Affordable Care Act. Checkups without co-payments. We'll see if this goes into effect, but that is the plan by 2018. So we will see if that happens. This is just a little blurb that I wanted to talk to you about regarding individuals who may or may not be part of the Affordable Care Act over time. We already talked about the undocumented individuals who don't enroll in Medicaid despite being eligible. There will be a percentage of people who are completely eligible for Medicaid, and for and individuals who, for whatever reason, decide that they're just not going to buy into it. So there will be percentages of individuals who just decide, for whatever reason, to not be a part of it. All right. I will. This is just a little, like, whatever quiz that I put together for you, but I'm going to skip the quiz, and I think what I'll do now is I will take some questions. So can I do that, Daniel?
Yeah, so if you switch to this right here.
Okay. Oh, look at that. Yeah, this button.
Yep.
Look at that. Oh, wow. Okay.
And so Q&A should pop up here.
Okay, hi everybody. So I can take questions now, and does anybody have any questions for me? You can type them in the Q&A area that I'm looking at right now. I don't see any questions yet. Does that mean that I was just like so proficient that you guys don't have any questions? Does anybody have any questions? No any questions? I'll give it another 30 seconds, because I could talk about the Affordable Care Act all day long, But I'll give you guys another minute, and then if you don't have any questions, what I will do will be, oh, hi, Angelica. Angelica has a question. Hi, Angelica. Oh, and you're very welcome. Angelica thanked me for the talk. Okay, what is your question, Angelica? You can ask, Angelica. Don't be shy.
It might be a long one.
Oh. Uh-oh. Angelica, be kind. It's late in the day.
Yeah, more than me bargained for.
Exactly. What are you asking, Angelica? I'm getting nervous. We'll wait for Angelica's question. Um, by the way, I have information about in my law school class. I do this, Daniel. I assign the entire Affordable Care Act Supreme Court case to my students. It's lengthy, but I have a sort of a scaled down version of it. So I'm happy to make that available to anybody who wants that to be available as well. So just you can let me know about that as well, and I can do that. Um, oh, good. Okay. Oh, hi, how are you? Okay, so I'll go with Angelica's first. So you're asking, are there already measures evaluating effectiveness of PH programs? If not, when will that really? Yep. When that really starts to go? That's a fantastic question. So yeah, there are programs already that are looking at effectiveness. Um, and in fact, I have this super crazy long PowerPoint that I did not burden Daniel with. That's like, I don't know, 50 slides. And it talks about some of these evaluation programs. Yeah, I'm telling you, the evaluation piece of the Affordable Care Act was a huge issue for the drafters. And it's pretty impressive because again, if you think about it, how do you really know how well the Affordable Care Act is functioning unless you're doing constant evaluation of it? So yes, some of it has started. A lot of it will continue on for the next decade, and there will also be evaluations of the rollout. I mean, you've seen it already, right? The roll anecdotally, the rollout of the Affordable Care Act, but also just generally assessing how the Affordable Care Act is impacting on individuals, who's signing up, who's not signing up, why are people signing up, why are they not signing up. So that will all be happening, you know, for decades to come. But yes, it's in real time. It's actually happening, and I can provide information about where you can get access to that. If you go to HHS's website, you can get some information from there, and you can also get some information from like public health service and so forth. But HHS is probably, if you go to their website, you'll get them best information. CMS is doing a lot of work to sort of looking at evaluating the programs. So HHS's website, CMS's website, both will have it. And you know what's funny too? I mean, I have a Twitter account through my nonprofit, and interestingly enough, if you access like some of these through Twitter, you'll get tweets on a pretty regular basis about updates to some of this programming. It's pretty quick and easy way to find out about it. So if you like Twitter and you're on Twitter, Facebook you can do it too, but I feel like Twitter's even more immediate. But Facebook and Twitter you can pretty easily find out some of this information. So that was a great question. Okay. People in the healthcare workforce actually do provide scholarships. Yeah, exactly. That's exactly what they're going to do. So a lot of these programs are in place because remember, again, there's going to be millions. Well, there already are millions of people, millions of new people in the healthcare arena. And as time goes on, especially with the individual mandate, with the Medicaid expansion, there will be millions and millions and millions more people who will be part of the healthcare landscape. So as these people enter, there's going to be a need for individuals who are versed in and trained in prevention, and specifically, public health individuals. So the thought is that you want to get these people in as soon as possible, and if there are people who are already in the public health arena, you want to have them interested in maybe diverting themselves to doing this kind of work. So the scholarships, the fellowships, the grants, they're all in place to entice individuals who either are not in public health at all yet, or who are in public health but maybe not really sure what they want to do in public health or in some other field of public health, to attract them to this area where there might be some lack of providers, which will be sorely needed. So yeah, it's special training, fellowships, scholarships, all of that is going to be in play for sure. Um, okay. Oh yes, thank you. Okay, yes. Iris, you're very welcome. She said thank you for the talk. She's currently a nursing student and was wondering how nurses can get involved in fellowships, collaborations, and educator wellness programs. Is that yes? That's a great question. Okay, so for your purpose, I would refer you specifically to which program would I refer you to? You should look at some of these programs that focus on nursing. Okay, so you're probably going to want to look at. Got my handy little sheet here. So write this down, Iris. Section 5202, 5208, and 5308 of the Affordable Care Act. This is nursing education programs. If I were you, I would focus on those because they're going to, these sections are expanding training for nurses, but there are also some demonstration programs that are going to be really interesting for individuals who are already in the nursing profession. And so I think it would be helpful for you to look at those sections so you can get a better sense of what's available. And then again, I would advise everybody to look at section 5204. This is this new program providing this $35,000 loan repayment for public health professionals who work for a minimum of 3 years at a federal, state, local, or public health agency. And probably just about everybody on this call would be eligible for that as long as you meet the other criteria. I hope that was helpful for you, Iris. So Kayla has a question about the penalties. Oh yes, that's a great question for you, Kayla. All right, so Kayla's asking about the chain restaurants, and it's interesting. So in New York here, it's sort of multi-leveled. The Department of Health has been doing a lot of work in this arena, but the penalties can be fairly severe. And again, because New York is a little bit of an interesting program because they've been doing this for a while, it's something of a model for the rest of the country. So we will see in real time how this plays out for everybody else. But if, Kayla, you're interested, I would Google New York. Just Google New York and Google, what I said, 20 restaurants, chains, so forth. I think you'll get a good sense of how it's playing out here in New York, and that'll give you a pretty good sense of what the dire consequences potentially will be for places further afield than New York. And I'm happy to talk about it offline. That's actually one of my sort of favorite areas to talk about. And so if you want to talk about it offline, I'm totally happy to. Okay, Danette says, thank you for taking the time to do this webinar. Why, thank you. Thank you for being here. She said it was very informative. She was trying to take notes, but missed some facts. Can you make yeah, absolutely. Can you make the resources you've referenced throughout the presentation available to us? Pretty please with sugar on top. Absolutely, Danette. I will ask. I will. Daniel's laughing at me. I will absolutely make these available to you. Like I said, I have a way crazier PowerPoint. I'll send that to Daniel, tonight. He can make that available to you. And then, a lot of what I went through, to be honest with you, like here, you can see here, my handy dandy notebook. Some of this are, notes that I have. I can put this into something that's a little bit more user friendly. a lot of it, I teach this on a regular basis. So to be honest with you, a lot of it I just spew forth, like a volcano. But I have my outline here. So what I'll do is I'll make the outline available and I'll fill it in with some additional information. And I think between the outline and the PowerPoint that I have, hopefully that'll be helpful. And I'm always happy to come back and do another presentation. So I was saying to Daniel before, I could jibber jabber all day. So, you just let him know if you'd like me to come back. I'm happy to, and I'm happy to do so. I'm gonna take like two more questions, and then I mean I could take 10 more questions, but I'll definitely take two more questions. And then again, if you'd like me to come back to do a part two, I'm totally happy to. We could focus on some of the questions that you have here. So I see, there's some questions regarding physicians and nurses. If you'd like me to come back, we can sort of laser focus on some of these. I'm looking at, hi there, how you doing? Um, yeah, we have like a couple of what provisions are in place to ensure the quality of care? Oh, this is a great question. What provisions are in place to ensure the quality of care is maintained, if not increased, in addition to an increasing access to our healthcare system? You know what? This is like the $64,000 question. So when you're adding 10, 20, 30, 40, 50 million people to an already taxed healthcare system, how can you ensure that all those people are going to get the kind of care that they want? And then in addition to that, and the care that they need, and then in addition to that, the people who are already in the system get the kind of care that they need. And again, we're going to see. I can't give you any assurances about that one because it's going to be a work in progress. And a lot of it is going to depend on, an example I can give for you are people who have pre-existing conditions, right? So individuals who have pre-existing conditions, they essentially have been lost to follow-up. So they could have been lost to follow-up for a year, for 10 years. We don't know, right? So when somebody who's been lost to follow-up comes back in, you don't know what they're going to look like. And I mean that from the perspective of what's their healthcare picture now. Chronic, long-lasting illnesses, that's going to be a very different animal than people who come in and they're healthy and peppy and fantastic and don't not need a lot of care. Now, the sort of dirty little secret, but probably not so dirty little secret about the individual mandate is that in order for this to work and work well, you need a fair amount of healthy people to come in, right? Because, if the system's going to be taxed with lots of people who have pre-existing conditions and are super sick, that's going to be problematic. So the hope is that you have enough healthy people that won't need a whole lot of care, that will purchase insurance and be there and kind of just sort of hang out and be healthy. And then that will offset some of the individuals who have the pre-existing conditions that are a little sicker and need a little bit more care. But it's going to be a little bit of a work in progress. So again, there are evaluation tools in place to track how the Affordable Care Act is playing out. But a lot of this is going to depend on who comes into the system, who buys in, I will take one more question, but I see other questions. So we'll see if we can save some of them. And I'll go through them actually, like individually. I'll go through the questions and I'll answer them offline. And again, I'm happy to come back as much as you would like. I would keep talking, but I know we limited this to 50 minutes. So I've already run over. I would keep talking, but I'm sure you guys have somewhere you'd rather be than talking to me. So this one is let's see. Let's get a good final one. Um, there's so many good questions here. Um, let's see. Oh, okay. So, this is a good one to end on because this is probably what a lot. And yes, I will physicians. Remember, For physicians, because we have a question here from Jason who wanted to know specifically about physicians. Jason, for your purposes, I highly recommend, again, look up Section 5204 of the Affordable Care Act. This is the one, the $35,000 provision that I mentioned before. There's also some like really interesting provisions with respect to primary care extension programs. So that's Section 5405. Again, a lot of this is going to be focused on primary care, prevention, so forth. So hopefully that's your interest. If you're interested in, being a neurosurgeon with a subspecialty the Affordable Care Act, there's a place for you, but there's a bigger place for the person that wants to be a, family practitioner. But look at those two provisions, and I will send around some more information for you that will hopefully be helpful. Um, we'll end with, this question that I have to do with. So yes, thank you. Yes, I was enthusiastic. I'm glad that you caught that. Somebody said thank you for your enthusiasm. I appreciate that. I'm gonna end with this. American Public Health Association. I will send the link to Daniel, and that should be a really good one for you. The links here, in addition, hopefully will be quite helpful to you. I referenced some of the sections. It's probably seemed a little daunting to wade through the Affordable Care Act to, go through all those sections. But honestly, I mean, I'm a lawyer by training, so the best source for a lot of this is to go to the original source. So it's not a bad idea to go to Section 5204 of the Affordable Care Act to look at the exact precise language, because stuff gets lost in translation. So, after you get to like the 16th secondary source about this, it may not be. It is thousands of pages, but it's not a bad idea to just have it, get it online, and then I will provide you with the sections that I mentioned. Just take a look, read them. They're not super lengthy. They're usually, short, like a paragraph here or there, but it's not a bad idea to look at the original sourcing, and then I can give you the resources that I have, and I'll give you additional information so that you can have it, and it's that's the best way. But yeah, I will definitely get you more information about these scholarships and fellowships and grants, because any of you that are about to be in the workforce or you're in the workforce, you should take advantage of these. It's well worth it, and very advantageous for you. So with that, I think I will end, Daniel, and hopefully we can save the rest of these questions. I promise I'll go through them and I'll just sort of triage them. They're fantastic, and then we can, maybe meet again, or have a part two. So, which I would love. So, thank you all very much. You were a wonderful audience, and you all stayed on and asked fantastic questions. And hopefully, we will see each other again. Okay, great. Thank you.
Switch back over.
Okay. Bye, everybody.
So thanks again to Ms. Heather Butts. For those of you who haven't yet filled out the webinar evaluation survey, please do so. It's the bottom link in the web links section. And for those of you who are alumni of the program, please do fill out the survey that we've recently sent you. And otherwise, we will post this video on our website. You'll receive an email when it is posted with the URL as well. So thank you very much and take care. Have a good night.